Good evening, ladies and gentlemen. Welcome to North Shore Live, Cooper's Corner. We're live this evening. This is May the 23rd. Are we correct on that?
24th.
Wait, what?
21st?
21st. we're jumping ahead.
We were just talking about her birthday.
My birthday is the 23rd.
Oh, happy birthday!
Thank you very much.
We're just so excited here. There's just so much going on, and this is May. We're making this the military month, and these two wonderful ladies who are on the program with me, as you saw from our front page, are going to be talking about traumatic brain injury, and we're hoping that we can help you, we can educate you, and if you are in need of some assistance, or you know a veteran who is in need of some assistance because of the experiences that they may have had overseas, in whatever theater of war that they may have been in, please, you can contact these ladies, and they will give you the information, or contact the traumatic brain injury of Illinois, the association. Anyway, let me introduce my guests to you. To my direct left, we have Ginny Lazara,
Correct.
who is a rehab nurse.
That's right.
At the Brain.
I'm the board chair for the Brain Injury Association of Illinois,
Okay.
and I'm in my paid job, I'm a rehab consultant for the Nolan Law Group in Chicago. But I've worked at Schwab Rehabilitation Hospital, and I do a support group at the hospital for brain injury.
Wow.
Every month.
Wow,
So-
that's terrific. And to Ginny's direct left, we have Felicia Deckard, who is the executive director of the Traumatic Brain Injury Association of Illinois, and a social worker, and wonderful, wonderful, wonderful speaker. That's all I can say is I just met Ginny this evening, and she's a delightful lady. But I had the honor and pleasure of meeting Felicia back in March when I attended a symposium it's called An Overview of Traumatic Brain Injury, the Invisible Wound. And she spoke so beautifully. I mean, real time, real emotion, the real thing, not just, hearing somebody speak, but delivering information to those of us that were there. There must have been 100, if not more.
It was a full room.
It was
wasn't
a full room. And living with brain injury and the effective communication strategies in acquired brain injury, it was terrific. I was so taken with her. And I'm always on the lookout for good and guests that will educate the public and inform us of what we can do. So listen, the show is yours, guys. So I don't know, where should we start? Felicia, you want to pick this up? And
Well, certainly, and I do want to piggyback on what you're saying. We met in March.
Yeah, we did.
Lake and McHenry County, and we were doing some presentations and training with folks who were providing services out in the community, and you invited us. You were so gracious to invite us to come down to Cooper's Corner. So now we know where
now you know
Corner
where.
is.
And please don't be a stranger.
We won't. We like this
And
invitation.
if you've got something coming up that's very important, for the veterans, don't you you've got a golf outing or something coming up?
We've got a lot of things going on, and that's why we thought when you extended the invitation, certainly we wanted to come and be a part of it, because you have got that access to the community,
Yep.
and many different communities. And for us at the Brain Injury Association, we are always looking for opportunities to get the word out, to raise the level of the community's awareness of brain
absolutely.
injury, because a lot of times folks just don't know what brain injury is about, and that's what we're about at the Brain Injury Association. We're a statewide organization, based main office is in Chicago, but we always kind of laugh and say we
all over.
our office is in the trunk of the car too.
Wherever
It's in the trunk of the car.
goes, that's where you
That's right.
We go all over, and as Felicia said, it's really important to educate the community, because a lot of people, they say a brain injury and they go, well, I don't know anybody who's had a brain injury, but we all do, and because a brain injury is an injury to the brain, and it can come from trauma, it can come from cardiac arrest, it can come from strangulation, it can come from anything that deprives oxygen to the brain. So it really takes in a whole host of diagnoses. You can have just a chronic illness that will asthma or anything that prevents you from getting oxygen to your brain. So it's really a wide umbrella, and we try to educate people that people that you may be in any given room, in any given space, there's going to be people that have had a brain injury. Some know that they've had it, some don't. But the term brain injury just has such a, it has some negative connotations, and people say, like a concussion may sound less, less horrible, but a concussion is a brain injury. It's an injury to the brain. So we try to, make people feel comfortable with those, those terms, and to really understand that a brain injury can look like any one of us sitting here, or it can be someone in a nursing home and not know it. I don't know how many times we've done community education programs, and we've had people come up to us afterwards and say, you talked about these different symptoms, and I've had these, and I had a concussion back in high school. I had a neighbor who the paper did a little article during Brain Injury Awareness Month, and I was quoted, and he said, I've lived next door to you for so long, and he goes, I really didn't understand, but he said, I had several concussions, and I've had these problems all my life, and I didn't know that until now. I thought I was just getting older or crazy. So it was really nice to be able to, to know is to be able to remediate or to compensate for some of those deficits, and if you know something, you can help solve the problem.
Well, you'd understand what the problem is.
Exactly.
And this way, you're putting it off for something else when in reality it's not.
Right.
Felicia, when we were talking about the veterans at that meeting, and you were really hitting to the heart of it, is saying you can't blame them for something that they really have no idea what's happening to them, or what they're saying or that they're doing, because the brain has received a severe injury, and you have to bring them back from that situation. Please explain to our viewers.
Well, that goes along too with the work that we do, is that raising that level of awareness, not just for the folks in the community, but for that individual, as Jenny mentioned, who has had that injury. Because for as many as there diagnosed brain injuries there's so many more that go undiagnosed. Mm-hmm. And when you talk about being able to identify, and when your neighbor had mentioned it, we often get those calls from folks who have a student in the classroom that all of a sudden they're exhibiting behaviors that no one can really understand. All of a sudden they're not able to get their homework done, and it's just the fact that they're not knowing. So we do try to educate folks on brain injury. You can have a brain injury and not lose consciousness, not require hospitalization. It can go undiagnosed, and sometimes it may not show up till a few years later, that all of a sudden it's the changes in how they're functioning, and changes in family life, changes in school. And so that we begin to talk to them, because we have an 800 number that folks can call in.
Better give it while we're talking.
800-699-6443. And the great part about that number is that folks can call in. If they have a question, they can ask it. They may be looking for resources. They just may need some support. And so they can call and talk with us, and we can share the information we have. But, as you said, getting that information helps them then begin to put a plan in place. And if someone doesn't understand it, they don't know what's wrong with them. So it can lead to depression and changes in the family, and how they're coping in school. And so once they've got that diagnosis and they know what's going on, then we can begin to put a plan in place.
Didn't we mention, or wasn't it mentioned, that 22 veterans a day attempt or do commit suicide because they don't know what to do. They're overwhelmed, and the consideration is that they may have brain injury, and so they take the final step because coming from overseas or not knowing who to talk to, where to go, feeling like an outcast, having depression, getting overwhelmed with simple things, screeching, yelling, something that they cannot handle as they did before they went. They never come back the same as they've gone into war, into a theater of war. Things that they've seen, things that they don't want to talk about, terrible depictions of their friends and their cohorts being shot, wounded, blown up by cars, tanks, whatever. How do we relate to this, since these are the veterans, these are the ones that went there to fight the fight and came back wounded? They came back, the invisible wound, as you have on here, it's invisible until they start acting out something.
You know, and you were mentioning some of the facts and the figures, and we were at a meeting just last week, and we were talking about the statistics and the figures, but we're looking at 2.5 million veterans that have served since September 11th. I mean, when you think of that number, that huge number,
that's huge.
And we're seeing folks that are serving, and they are preserving our rights and our freedoms, and they may be over there and have been a part of, just from a distance, with blasts or explosions, may not have received an injury, and when they come back home, they may still have sustained a brain injury. And so sometimes those aren't visible until they come home, and the reason being, and we can talk about a little bit later some of the things to look at, but a person, once they're in their serving, they've got a routine in place. Someone tells them when to get up and when to go to bed and where they need to be at, and so that structure helps preserve them in that setting. And so once they come home, then maybe that structure's not in place any longer. There's not that time frame.
That's right.
And oftentimes for us, that's when we start getting the phone calls, and I know that we're looking at veterans issues this month on your show, and certainly when we talk about those numbers, for us, it's a high percentage of folks who sustain a brain injury in the military. A lot of it is through the accidents with the vehicles, falls, the activities they're taking part in, but the majority of their injuries are those concussions, and I know folks say it's just a concussion, as Jenny was talking about. It's a concussion, it's a brain injury, and so they can be diagnosed, and it may be undiagnosed, and for us, sometimes it's the family that may be calling, because once that military serviceman returns home, resumes his activities in the family, and changes in the role in his relationships and the duties he has, that's when folks sometimes begin to see some changes in their cognitive. And that's when we may get a phone call saying, he's been home, but I sent him out to the store for a couple things at the grocery store, and what should have been a 15-minute trip, we're still waiting an hour later because maybe he forgot the route to come home, or he forgot what he was supposed to pick up. And so that's sometimes where we can give some support and education, and part of the reason that, and you can see on our website, but we've got a film that we produced for that very reason, The Journey Forward. And it was so that we could share with military families, if they may be having questions and concerns, that they could view it in the privacy of their home at any hour, and maybe begin to have a little bit more of an understanding and know that we were a resource for that.
Because can you imagine, when they come home and the family's ready for them, they're so excited, and they come home and they want them to just resume, being the father
as they were,
and they can't. And the conflict is just really, we've seen just very difficult for them to cope with. That just adds more pressure. And as the families begin to understand that and put into place, maybe lower the expectations, maybe, not have the party right away, or not have so much activity going on, or just to try to understand. That can help a lot, but
You know,
it's
we
tough.
need to go over this again for our viewers. I mean, because I know you want to understand this, that they can't resume because they don't see any physical wrong. They don't
Right.
see them physical wrong. But the concussions that they receive from bomb blasts over there, over wherever they were, shooting or rock falling or explosions, that causes some reaction in the head, in the skull, in the brain. And
Right, especially when people don't understand that a lot of the blasts and the fluid in the brain shifts and causes damage to the internal, parts of the brain, and it's really tough. So it can seemingly they say, well, I didn't get hit directly, but you do have the blast.
Yeah.
Really can cause quite a bit of damage.
So between the blast, Jenny, and the stress of going to fight the fight, when they return, what are we seeing?
In ways of how they present themselves, they
Yeah.
can be withdrawn. Mostly withdrawal, you can see signs of depression, agitation, less tolerance for, maybe the kids are, all excited about him being home or her being home, and, they can't take the activity. And that's like usually the first sign. I mean, there's just too much. And as Felisa mentioned, they're so used to being regimented that once you get into your home life and back there, you've got a lot of freedom, and you begin to fall apart a little bit.
Because you're not, the structure,
The structure
isn't there.
is not there. And in
Yeah.
brain injury, no matter in the military or not, one of the key things in rehabilitation for a brain injury is structure. A high structure really will begin to get the brain in kind of a groove. Whether it's from simple, even getting dressed if you have that kind of severe damage, or even just keeping your schedule, or knowing what day it is, or knowing, to take the kids to school. As Felisa mentioned, I had one person that was supposed to be taking care of the kids at home, and he just went out and he forgot that he was babysitting. I mean, the kids ended up being fine, but a neighbor saw him, and he just didn't know, and how terrible he must have felt. It was not intentional, but he just, you don't have, the brain governs everything, who we are and what we do, your personality, your physical, everything. But it's those emotional and personality changes that I think cause some of the most distress.
So we need to tell the viewers, if they're, when they're, now they're watching, we need to tell you not to be so, self-absorbed with what you need to have done, but to have a little patience with the veteran.
Right, and it's difficult because the families have sacrificed so much.
They've been without.
They've been so you understand that on one hand, and they're asked to be even more understanding once the veteran comes home, and it's just really hard. You're working with the family, a whole family dynamic, mothers, father, whoever
Everybody,
it is, the
yeah.
kids, everybody. It's really tough, and it just requires support. And I mean, that's why I love doing what we do, because it's great to have a place where you can come. No worries. We'll talk to anybody. We'll help you. We'll give you resources.
And nobody is blaming them for anything.
Not at all.
You're
Not at
coming
all.
there for support. You're going to some
Right.
place that will give you the
Right.
necessary help that you need.
And there's help available.
And you
yeah.
can buddy up with somebody if that's
Right.
the case.
Right.
Because these guys coming back, they had buddies there, and now all of a sudden they're back home. They don't have their buddies. They don't have anyone to buddy up with. They've got to do it on their own and back in the family structure when they've been, 1, 2, 3, 4 tours
Right.
with someone else watching their back.
That's
Well,
right.
and we also talked too with this current group of military service personnel. They are different from other past wars and efforts in that they've been had to be at a state of readiness at all times. That in times that there have been times that they've had maybe downtime, but these are veterans who have been constantly on duty, on guard, in action, and so that they have been that hyper vigilant. They've always been watching out what's happening around them and surroundings, and that adds to that the fact with the structure. But once they get home, it doesn't stop there. And I think that's the thing when you were talking about earlier, that you may look at this individual and think, well, everything looks fine,
It's okay.
and they're telling you they're okay, and they're able to walk or ambulate and to talk with you, and you don't see that injury. And I know that sometimes folks will say, well, if you could see it, then people might be more understanding, or give me a little bit more of a break, or a chance. And the thing is too with brain injury, whether it be a veteran or civilian. If you've broken your leg, or you've had a cut and they've sewed it up, put stitches in it, or put a cast, that there's a specific time frame for that rehab and that treatment. A person with a brain injury can be ongoing, and I think that's the thing that we need to be mindful of, that we've got folks who are returning home, that this may be years down the road that we're looking at, that they're having to cope and to adjust and find a way to make their life normal. And I think that's what we can do too, is that helping to identify and giving some strategies, because we want to build in success and ensure their success as an individual, as a family member, as a person returning to work or back to the classroom.
Even something simple like addressing the sleep issues.
I was going to ask you about
the sleep
that.
issues are huge, because just from a nursing point of view, if you're not sleeping, everything else goes.
Sure.
That's very important. And I remember going to a military conference, and there was this general that explained what it's like the enemy. I think it was in Afghanistan where he was, and he was talking about how the enemy will wake them up in the middle of the night. They'll start the raids. They're not going to do anything, but you have to get up and get ready and go in the hole or wherever they were, and disturbing their sleep constantly, day in and night after night after night, breaks them down.
Well, sleep deprivation, absolutely.
It does. And to me, I thought, I never thought of that. I think we have a lot to learn from the people that are coming back about what happens in war. We just think, they go off to war, and if you don't have anybody in that, you really don't understand. But when they get home, addressing the sleep issues, and there are places where you can go, and physicians who know about that, to be able to at least get that started and be able to sleep. Because with PTSD, post-traumatic stress disorder, a lot of them are reliving the nightmares, and as Felicia mentioned, they're hyper-vigilant. If there's maybe there's a sound, or one of the children drops a toy or something, and they're like this, and it triggers something.
Yeah.
So, just those issues, just to little by little, just address those, and maybe once they start getting sleep, they can address another issue. But you need to have people who know how to treat brain injury. That's really important.
Brain injury. How did you get started as rehab? Did you? You didn't start out like that.
No, I had no idea. I didn't.
Okay.
I had no idea. I
Okay.
went into nursing, and I ended up on a general rehab floor, which we have amputees and spinal cord injury and brain injury. But I remember thinking I never wanted to go back to the brain injury unit because they were different. There was more
Very different,
behaviors
yeah.
and stuff. And I had a director of nursing at the hospital who said to me, I was there a couple of years, and she said, Ginny, I want you to go back to the brain injury unit just for a couple of weeks. Someone's going on vacation. I'm like, okay. But I ended up doing it. I went back there, and I never left. I never left because it challenges you from a nursing point of view or a medical point of view. You have to address every issue of a human being when you're dealing with brain injury. I love that about rehabilitation in general, but I as a matter of fact, I still see some of the patients that I had almost 30 years ago.
Wow.
They come to the support group. They've been maybe gunshot wounds to the head and that, but I just loved it because the people, you get to really know someone really well. And those were back in the days when the length of stay was a little longer. Now we have to work, with medical issues, and you have to work quickly. And that's why I became interested in outpatient and more living the rest of your life. And that's why I've been so passionate about support groups. Both Felicia and I do support groups, and the Brain Injury Association has affiliated support groups all around the state. But I've loved it because you can once a month, people come. I had a women's group at one time, but we don't have that anymore. But because women's issues sometimes can be different in brain injury. But we've got a group for families and people with brain injury, and we've had it for I think it's 28 years now that we've been doing it.
That's sustaining
I
for
think
sure.
28 years I've been
That's
doing
pretty
it,
good.
and we get new people in and out. But I've been truly blessed to know people, and yet, what's really great is when I first started in brain injury, there was this 6 months plateau. You plateau or a year,
Yeah,
they would say
that's it.
that you can't get any better. But oh my goodness, the advances in brain injury research, brain injury rehabilitation, you continually get better and better, and you can. I mean, some do, some don't, and I think the other thing that attracted me to the field is that everybody's different. You know, I could hit my head on in the same place you did, and we both have entirely different symptoms. So you really have to be very individual. Your care plans have to be very individual to the family, and you really get involved with them. And I've seen amazing things, miracles happen. You know, there've been some not good things, but I've seen people that I used to think, well, I don't know what you're going to happen, and yet today they're walking around, and they have issues to deal with, but they've had the support and help, and it's great.
But they know
You can
what the problem is.
That's right. When
and
you
that
know
you're
it,
working
that's
with
right.
them.
That's right.
Okay, they're not just out there.
That's right. That
Alone.
you understand and you
Alone.
support. It's all for any one of us.
Yeah.
It's wonderful to just know that someone's there and just to listen to them.
Well,
Yeah.
and that's the name too of one of our films. The first film we did was "You Are Not Alone," because oftentimes that's the
They're
first
alone,
thing that
yeah.
they may be saying when they call us
Right.
is that I feel like I'm all alone, that no one knows what I'm going through, and if anything, I would say that this seeing more with the brain injuries in the military, and even now as we talk with professional sports and that sort of thing, it's allowed people to not be so concerned now about speaking of it in public or talking about their experiences, and because the more we can talk about it, then we can look at some strategies and treatment and things that would work for someone. And we have a term, anytime, anywhere, anyone. And and as Jenny was mentioning, every time we're out in the public, there's always someone who kind of comes up to the side of you and say, I had this. They'll talk about some symptoms, and they just said, I just didn't know what it was. And maybe they'd never had that diagnosis, but as we begin to talk about it, and they can maybe trace something back. It could be a fall. It could be, and I don't want to say as simple as, but
Right.
falls on the playground. It could be that traumatic injury where you're unconscious, you're in the hospital, but there's such a wide range of what is a brain injury. And as you were saying, that we could each take the same blow to the head, and it would affect us differently. And that's really the mystery
Right.
with the brain injury. How to visualize it.
And
how
it may
to-
not, you mentioned earlier, it may not come up right away. So you may have symptoms months or, down the road. And, you really have to, to kind of be okay with talking about it. I think from the time I started in the field, and so did Felisa, till now, we talk about it way more, and everybody's more open about it, because of the football players and now the military. The people don't feel, quite as, like before they didn't want to say they had a brain injury. Like, especially we have a lot of this with returning to work. They don't want to be labeled with that.
But it's not that you are labeling someone, but if they don't know what the injury is, how can anyone
Right.
expect to be able to treat it, let alone when you're in a social area, know
Right.
how to understand what the problem is. You can't just be whispering behind someone's back. Like you mentioned before, if you have a cut, you've got stitches, okay, you could see that. You could see it. If you have a broken leg, well, you've got a cast on for a little while, or you're walking with a crutch or a cane, and it heals. There's a timeline on it. But you were saying, Ginny, that it takes time for this to dissipate, as it were, or to relearn what you were before this happened.
And you're never really going to be the same ever, but we all change. And but we say you can be. A lot of our patients say the best me I can be,
best.
and it's just really hard. Rehabilitation means that you learn new coping strategies. You learn how to do something differently. So, say if maybe you need to use a day planner a little more.
To check. Yeah.
I think everybody. Yeah, I always could use
could
that.
certainly use that. That's not a,
No, and just there's little things that you could do to make your life easier, and especially when you're on the job, if you're helping someone get back to work, that there's things that they can do, and you can, we love to educate the people around them, their coworkers, and we love to go into companies to teach people about brain injury, because it's not, they have a lot of misconceptions, from the television and from just saying your brain isn't working. But, there's a lot of things that you can do, and there's a lot of ways that you can still lead a very successful life and just be, have a good life. And I think that's what our passion is getting people the knowledge that they need and the power to be able to live a really good life.
And, I asked Jenny how she got started because she was a nurse for rehab. Did it give you any pause going into this? Were you just, social work for family, or how did you get involved with veterans?
Well, I was going to say, probably as I
military.
got involved with brain injury, I don't think anyone goes into
You
it
go-
intentionally.
no,
At first, you
you're
think,
chosen.
okay, and you kind of find that way.
Chosen.
Yeah, I was doing a lot of work out in the community with placing folks working with the developmentally disabled, and began working with a group that I operated a neurobehavioral program for folks who'd sustained a brain injury, and so that was really what my experience, my first experience seeing that. But the thing that really struck me is that this could be me tomorrow.
See.
This could be any one of us, and that's what folks need to know, that it can happen at any time, and it disrupts your life, whether it be for a short period, maybe forever, different degrees, but it not only is it yours, but it's your family. And so, it does, and as Jenny talks about, I do believe that it is a passion. It is something, because I look at someone and think, this could be me. And we use as an example that we do a summer camp program, and we always will talk to the college students who are working with and volunteering their time with us, and one of the most profound, I think, memories I had was that we had given this talk and the training to the counselors and talked about it, and we said, this could be any of you. Yeah, and you
There,
hope
but
that,
for the grace of God.
exactly,
See?
and you just want them to know, because this is a person who's maybe looking to you for peer support,
Sure.
just socialization, and several months later, there was an injury, and so that counselor came back later and said, I remember what you talked to us about, and he said, I want to be that kind of person, to be able to show someone and to model what can happen as you go through rehab and recover, and it just makes you stop sometimes.
But
to
it
think of
takes
that.
a special person, because I was so taken by hearing you speak. Believe me, I have been on a whirlwind of all these, everybody speaking to this and that, and listen, there was a commander, wasn't he a commander?
Yeah.
Or they came after you that was speaking. He was the real McCoy also, not just everybody giving, telling you something.
Mm-hmm.
He really explained everything that, I should read his name as well.
Commander Joe, I believe.
Yeah, Joe Troiani.
Yeah.
Yeah, Joy
Yes.
Oh, he's really
improvised explosive devices, IEDs, and the signature injury of the Iraq-Afghanistan war. He was outstanding.
He's the one I was talking
Yeah.
about, how he explained
Wow.
the
He talks
sleep
about the military
deprivation.
culture,
He
just so people will understand.
Yeah,
it.
hey,
Yes.
he's living it.
Yes.
What did he
That's
say?
right.
35 years he's in the service.
Yes.
My goodness sakes,
Wow.
he is living it. He knows. We're the ladies here. We're talking about being scheduled. They have to do this or under command.
Right.
He's the one that gives the damn command.
Gives the command.
Get your ass out of their bed and do whatever you have to do.
Yeah.
He
Yeah.
was outstanding. He
was.
was. Maybe the next show we should have him on. Maybe he's free for next month or whatever.
He's very
Doesn't
interesting.
necessarily
Very
mean
good.
has to be militarily. Boy, he is very dynamic. I think, you, the viewers, would be just as wowed as I was sitting in this full room of concerned people, caring, concerned, wanting to know, wanting to help. What can we do about traumatic brain injury? And he was so dynamic. He took the award. He took the award. If there was an Academy Award, boy, he got it.
He just, and you know, having him on, I think would be great because just listening to him, he just enriches your life to know what,
He was
to understand.
terrific.
Because a lot of us don't. We
I
just
was
don't
just
understand.
in such awe because
Right.
he's a military guy that is telling everybody. I mean, he's a PhD and CADA, whatever those initials are. I'm sorry, my information here, but he was real. All of you are real, but like I'm telling you, I've gone to some of these places. They talk at you. This is what they're going to say, and this is what they're doing, and you know, whatever you get out of it, okay, you know, whatever. I'm just here for like a half an hour to give my speech, and I'm having coffee and a donut, and I'm gone. You guys, you were there, Felice. You were there. You understand. You took questions from the crowd. They listened to you. They applauded you. They were willing to sit and listen. I mean, we travel the distance up to Gray's Lake to be able to, hear you speak, listen to what you had to say, and take in the compassion that you were offering everyone, to be compassionate to those with this injury, this invisible injury. You impacted me unbelievably so. So that's how I'm going to impact you to let you know that these ladies are here for your help, your education, your knowledge. Hopefully you can put it to good use. Please give the number again.
Our number is 800-699-6443. You also can email me at info@biail.org. So phone call, email, our website. You know, the other thing, when you were talking about it though, now with changes as far as with services that are available to the veteran and community, you know, we're seeing more and more community service providers who are seeing those veterans in their practice, whether it be at veteran centers, American Legion, it could be a community mental health clinic. That's why we feel it's very important, because this may be the first time that an organization or a clinician may be seeing someone with a brain injury, not really understanding some strategies that could be used, because we would all agree that we're there to provide support and to build in success, help that person to learn some strategies and things that they can work on at home and to go home with. And that's what we had talked about, because it's just some simple things that when you understand that it is a brain injury, that the memory, there may be memory impairments. Well, what can we do to help this person? And as Jenny was talking about, do they work better with writing their messages down on a pad of paper? I know we talked about, we've got some who will not get rid of the old answering machines because they call themselves during the day, leave a message, go home and write it down. So it's just those type of strategies, because sometimes in the past someone may say, well, this client I'm seeing, our patient, they're not compliant. That's always the word that gets thrown around. They're non-compliant.
Inappropriate and not
inappropriate. And so, the thing is that, are they non-compliant, or did they maybe forget about their appointment? Did they have take a little bit longer time getting there with their mobility, that sort of thing. So really trying to find out what the strengths, what the weaknesses are, and then how that brain injury may impact. We talked too about the lighting, that day.
Oh yeah, that's right.
That sometimes fluorescent lighting, it may be hard for that individual to focus on what you're saying.
The incandescent is
because
better,
of the light.
Yeah.
Also, too, I know that we do a lot of work with classroom setting, because someone may position a student at the desk right by the window, and so they're looking outside, seeing what's going on. Well, it's hard to focus on the instructor. Sure. That's the same way it is at a job. So really, what we try to do is find out where that person is at. What what the setting is, and we've talked from the onset about the structure, that need for routine. You're talking about a person who has been always ready, be looking over their shoulder in this military setting. Once they come home, and then they may have a brain injury. So add on to that the startle factor, that and I think I gave my example of getting clocked one day at camp because just not thinking, I wanted to raise my hand and pat someone on the shoulder, and that was a startle because he just didn't see where that arm was coming from. So, that's not his fault. That was me maybe just not being in front of him to let him to know what I was doing. Exactly.
So you have to kind of warn people.
Yeah, so you look at sometimes their orientation, spatial, visual, the cognitive issues, and then that we can work with that.
There can even be, and also I'd love your viewers to know that if they go to their primary care physician and maybe they have a concern like that, and sometimes they don't know enough about brain injury, they just don't. I mean, I think more and more they are, but to call we can provide, help and people that deal with brain injury exclusively, so that there is help. But sometimes the primary care physicians, they'll just send them home and they get more frustrated. So just to call and to talk, and we talk to the primary care physicians.
Well, what is a consideration here is, what if these veterans, these service people come back, they do have brain injury, traumatic brain injury, people pass them by because, like we said, we can't see it, it's invisible, you're not limping, you're not whatever, we don't know, you're not getting sympathy because, or help or assistance because we're not seeing what the problem is. But we don't want them to wind up on the street, we don't want them to be street people, we don't want them to live under bridges, we don't want them to crawl into a hole somewhere. There is a life that they can lead, but we need to get them out of this situation. We have to withdraw them. I don't know, but whatever means that you have to do this for them. But I mean, you guys are the professionals. We're parents of the ones who went overseas, so we can tell you what they're like when they come back. They just stand there and they're like, they don't know where they're at. You're home, you're here. We're not striking the same bell here.
It requires so much understanding on the part of the family for that, and it's really difficult for family members, especially young families with children. Say it's the mother's had a lot of responsibility while maybe her husband's been deployed, and then he comes home and she thinks things are going to be a little bit better for her, but they're not.
Yeah.
So I think.
And yes, what do you do with cases that wind up in divorce court because he's not the same, he can't feel towards her or the family in the same vein he did before he left. The children don't understand what's happening. This causes a rift between the families. She may go to mother or whatever, take the children. He doesn't even know what's going on. He has no idea.
That's
and
true.
It's not that he doesn't care.
No.
It's because he doesn't know what's happening.
That's right. It's very confusing.
It's real, but it's very real.
It's very real, and it's in the civilian population. And also, I mean, we've dealt with this all along. A brain injury can really disrupt a family. It can really cause a lot of problems, and the divorce rate is very high. There's a lot of guilt on the part of the spouse that is not injured because they feel they need to be there, but yet the person comes back to them sometimes changed.
They're wounded. They're absolutely wounded. They are wounded warriors. They are absolutely wounded warriors.
Right.
I don't know if I want to go into this or not, but I'm going to jump in and just tell me if yes or no. The VA hospitals, now we've got one up in North Chicago, Great Lakes, that, is a brand new facility, I don't know exactly how they stand on any of the brain injuries, so to speak. I know they're quite efficient on any of the physical situations, but Have either of you been to
Well,
there?
we've had experience, and I think I'll let Felisa mention that with Heinz and some of the work that they
Heinz,
do.
oh, in Maywood. Okay.
That's
Well, you
right.
know, traditionally it is tough. You know what you've seen with a person who's served in the military, a veteran, and receiving services. Sometimes it has been hard for them to step outside the system to receive services. You know, from the community, and there may be programs. And I think that's something we've kind of struggled with, that we may have the services and programs, but you know that veteran or that person may be hesitant because they're within the VA or the military system. But I think we have, and I can speak from us with the Brain Injury Association, we've been very lucky that we've been able to build some relationships with those teams within. And as you were talking about with up here with Great Lakes, also with Heinz, we had the brain injury team work with us with some education and filming that we had done. They've also been inviting us in. And I think sometimes so that can also help us let that veteran know that we are a resource that's out there. We do a camp program each summer. We opened that up, and we were seeing more veterans coming into that camp. You know, and it gave them a chance to kind of take a break, gives the family a respite, and then also too it gives that individual a chance to share amongst other people who may have the same fears or issues they have. And then the other piece is, in that whether it's that person receiving services, sometimes they're just looking for some activities, some socialization activities, and so that we've been able to go into within the VA hospital, talk about a program. And we've got a unique program really that we've set up, is a judo program. And we set it up because I would say probably one of the biggest concerns someone who's had a brain injury will say, you know, I don't have any, you know, I don't have the same friends, you know.
Yeah.
They've kind of fallen by the
Friends go
wayside.
away.
So whether it's a civilian or a military service member, you know, they may not have that socialization opportunities. And so we developed a program to look at physical conditioning, work on cognitive skills with judo, which we've been finding out is
Physical.
that you have to have a routine. You have to know when to
yeah.
put the jacket on and what to do when you step on the mat.
It's perfect.
And then also to be able to socialization. We opened it up so that an individual, that person with a brain injury, could have a family member come on with them. You know, can come onto the mats and exercise, or they could bring a buddy in with them. The new class that we recently started is with Brett Wolf, who is a National Paralympics award-winning judo instructor. That he's opened it up for veterans, and so that they can come, and it's a chance for them to just hang out together. And we're working on physical conditioning. We're teaching folks how to fall safely, you know, and that was something that, you know, is a concern sometimes. But also they're working on the cognitive and socialization opportunities.
We might ask, I mean, people who are watching, what is the cost? All this sounds good, and they'd like to participate because perhaps they don't have a veteran, but they have someone in their family that has suffered traumatic brain injury, either from a fall out of a window or being struck by a car on a bicycle on the street, or some other serious.
So many ways.
How do they? What is the pay situation? The bottom line is, what is the cost for this, either veteran or civilian?
Well, bottom line is you can call our 800 number and ask for resources.
Good, you
and
took it off of my hands. That's it. Good.
And you can, and you know, we can provide those services, and that's important because a lot of times people, their insurance maxes out. You know, the case management services, hospitalization. You know, there's no charge to call us.
And I think that's why we're lucky to have someone like Felisa, who is a social worker. I mean, she's the executive director, but she's also got the clinical background, and I'm a nurse and a volunteer, so we can do that. And plus, the judo is
the judo. We have
maybe they need hands-on,
and we've made to make that available, so there's no charge for the judo program.
Wow, that's
and camp we always try.
That's wonderful.
Support groups you can attend. We've got support groups all around the state, throughout Chicago. We invite folks to come and take part in it. We do a conference each fall, and that's why you know, we always trying to work hard to, you know, if we've got someone who wants to take part in, you know, camp or an activity, you know, we
It's
we
wonderful.
make it happen
We
one
have a
way or
s-
another. So
We have a support group on Saturday at Schwab Rehabilitation Hospital at 1401 South California, and we'll be there from 10 till noon.
This Saturday.
This Saturday.
Drop in
Okay.
and see us.
Do it again. Say it slowly.
It's a Schwab Rehabilitation Hospital. It's part of the Mount Sinai system. It's
Okay.
1401 South California Boulevard. And you just come in and they'll direct you to we're on the third floor. Yeah, we're on the third floor.
Okay.
And we're both there from 10 till noon. So
10
just
till
pop
noon.
in and you can talk to us. And there's other
Okay.
people there.
Is there
and
coffee and donuts?
coffee and donuts. Otherwise, we
Hey,
could not.
always
Yes.
coffee and donuts.
That's wonderful.
There's always food.
Coffee and
we're
donuts is
excited
good.
about our camp program coming up at the end of June. So we go for a week, and we've done that for about 20 some
Those
years.
for our youngest is 7 years old.
And
We've
our
got a
old-
youngest 7 and
Our oldest is
oldest-
almost 80.
Yep. So we've got a wide range come to camp, and it's the only camp in Illinois developed specifically for folks who've sustained a brain injury.
Wow.
And that's real important to note because we build in a lot of cognitive activities, a lot of peer mentoring, a lot of cueing,
Yeah.
a lot of assistance.
And they
that
get
way.
to really, as she said before, socialize and become friends.
Socialize.
They get really good friends.
You know, after they come out from the military, they're extricated like you know, pull someone out of
Right.
mud,
Right.
you know, because
The
there's
jaws of
they're
life
hang-
is
yeah,
there, yeah.
they're hanging on to
Right.
what they know, and then all of a sudden you extricate them from the military, and they say, okay, you can go on your own way. But what? We've trained for
know.
this. We're in battle. We've come
I
back,
know.
and now you just put us out to do what?
I
To
know.
do how? They need to buddy up. They need to have someone like you know, Alcoholics Anonymous. Call somebody up. Hello, I'm having a problem. Can you come here? Can you help me? Talk to me. Let's meet somewhere. Come to my house. I'll come to your house. Someone who's stronger than the other one. You
Right.
put the strongest one with the weakest one to be able to help pull that one out.
Support groups are amazing.
need a
They
support
really,
group. You need a
and
support
some
group.
people are a little afraid. They're not really ready after they're discharged or if they've been in acute care. But I've had people in the support group, and some come in and out, and just they pop in when they need it. But it's very casual.
You know, this can't be called mental illness.
No.
This is an injury.
This is an
Exactly.
injury.
So when
yeah.
someone commits themselves to a hospital and they're acting differently, people who are not aware that they may have served overseas or whatever are saying this is a mental situation, when in actuality they're being tagged as a mentally ill person, disorientated with social whatever, but in reality have suffered a brain injury, and they don't know if they should go or leave or what they should do because
It
you just
affects every-
said.
That's that's
You
very
just
interesting
said
that you brought
that.
that up. Yeah,
Yeah.
you brought that up because that is the case very often that someone will be hospitalized, admitted to
Because
a
they think it's-
psychiatric
yeah,
unit because they
psych
maybe
unit,
exhibit,
sure.
yeah. And when in fact it is that brain injury.
It's
and
a
so,
brain
so that
injury.
treatment may be different than what you would have.
The
treat
treatment
someone
would be
with brain
quite
injury.
different sometimes.
So that no,
yeah.
that's a
Wow.
perfect point that you brought up.
That's just
You need a
incredible.
diagnosis. You need an appropriate diagnosis, and a brain injury can and often does affect every system of your body. You know, you can
Sleep, eat.
digestion. You can become like I have a lot of patients that are diabetic, and a lot of those issues come with the chronicness of a brain injury. It's a chronic disease, and
Brain injury. They
Right.
don't, do they admit that they have or they don't even know that they do have a brain injury? They just become irate, or how does the client, the patient, relate to when you say, you've been overseas, you've been in the midst of a bomb blast, all this is happening, and you're not mentally ill, but you have a brain injury. How do they relate to that?
Sometimes there's a sigh of relief
yeah, they
just
can.
because
because
someone
they-
says,
someone
now
said,
I
yeah.
know.
Now,
And then you can start
there's
working.
a name
And then you
for
can
it.
start-
There's a name for it.
Exactly,
Oh.
exactly.
And you can begin to, and then the more trust, and the more they're open, and
Building trust.
a good clinician will be able to diagnose that
Wow.
and to be able to begin to help them.
You have just
and
opened
direct
my
them.
eyes because
Yeah.
I'm one of the founding members of the Alliance for the Mentally Ill, some 35, 37 years already. And a lot of the people that we see, it was AMI, the Alliance, now it's NAMI, the National
Right.
Alliance. The people that we see, maybe not mentally ill, they may very well have suffered a brain injury of some sort, whether it was falling down the stairs. They don't have to be veterans of some situation, and they didn't think anything of it. They
Right.
got up, dusted themselves off, but then they're
When we were kids, we were always falling.
Exactly.
So you just,
Exactly.
Isn't
you
that
had to just,
incredible?
Yeah.
but to be
Wow.
able to really diagnose that,
That's
that's the key.
a real eye opener. That
Yeah.
is unbelievable. So we should tell our viewers, how do you really know if someone has suffered this traumatic brain injury, or and someone is taking them for having a mental disability, a mental illness? The two are not the same. They're both located in the head, but you need a true clinician, a true physician, a neurologist. Would a neurologist
Yeah, and
be
that's
able
where
to
we
do
can
that?
give resources.
Yeah.
So
Oh.
based on
We
wherever
have all
someone's
that.
at, they could call, and that's one of the questions, find out
We
where they're
direct them.
at, and we could direct them
Wow.
to some resources.
What an eye opener.
And so that's what we just want to do, is
What
be
an-
a resource.
And there's
What
a lot
an
of
eye-
information on our website too. So
Okay,
that
better
you
give the
go ahead.
website, give everything.
Okay, www.biail.org.
Okay, slowly.
biail.org.
Okay, we got 2 minutes to go. We got to wrap all this information up. You've got something up in July.
I sure do. July 15th. I don't know if you're a golfer or not, but we're going to be at the Glen Club. And, we talked about the
Only
services
if they
we
have
provide.
dinner, a brunch, or a buffet.
They
then
have,
there's-
they have
Yeah,
dinner.
we have
Okay.
dinner.
Always
golf,
food for
golf
them.
in the
Yeah.
afternoon, and we've got a dinner. So we
Dinner in
have
the
some
evening.
folks who just come in for the dinner. July 15th, you can find information on our website.
And where
It's
is that
open
gonna
to
be?
the public at the Glen Club.
Right up
The
here.
Glen Club.
And this is a way that we raise money for our injury prevention programs, the programs we were talking about, the camp, the public awareness.
Wonderful, wonderful
This
work.
helps us continue to implement.
And we
Oh,
also
goodness.
have October 24th and 25th. In Drury Lane and Oak Brook, we have our annual conference, and that's where we have physicians, nurses, therapists. We have all kinds of information on brain injury, a wonderful conference. We address, research, clinical practice, living your life, the outside world. We have a lot of hospitals represented there, a lot of resources, and it's great for families, people with brain injury, nurses, physicians. We give continuing education. So it's a great conference. So
And
we
so
encourage
it's-
everybody to come because you get great information.
Well, we'll have you on before that, but I'm glad that you're mentioning it now.
Yeah.
They can put it on their
Put it on your
calendar.
calendar.
Put it on
It's
your
great.
calendar. And to learn about this, you could go on the website or call the number, the 1-800-699-6443.
800-699-6443.
Okay, that sounds good. I just want to mention quickly, this is Memorial Day weekend coming up, and North Chicago has a North Chicago Field of Honor. It's a Memorial Day weekend. North Chicago Veterans Memorial, 1801 Sheridan Road in North Chicago. And the exchange, presented by the Exchange Club of North Chicago. And you can purchase a flag. They have flags that you can, purchase flags. It's really remarkable what they do, and we appreciate with great honor the work that the Exchange Club does for everyone. Honor a hero, sponsor a flag, and you can contact them at 224-572-9888. That's North Chicago Field of Honor for Memorial Day weekend. Be safe, be happy. Thank God we are in America, and be kind to our veterans as they fought the fights